Alright guys, high yield video for the USMLE. Today we're going to be speaking about all of the causes for acute kidney injury, which you can learn with this simple diagram over here. Now if we look at pre-renal failure, we just need to look at this diagram and see any sort of problem before the kidney. So first of all, we're going to start with the heart. So heart failure can cause pre-renal failure. Any sort of volume loss, so that can be diarrhea, vomiting, sweating, dehydration, surgery, because surgery damages vessels to our organs, and any sort of shock can cause volume loss. Now why does this cause renal failure? Well, that's because of three underlying pathophysiology mechanisms. One is that we get decreased blood flow towards the kidney. Secondly, that consequently leads to decreased amount of filtration rate. And thirdly, that leads to a buildup of nitrogenous waste products in the body. So that can be quite damaging to this person. Move forward in this diagram and we come into the kidney. That's going to be acute tubular necrosis. So why do we get acute tubular necrosis? One of the main causes is volume loss. So everything we mentioned previously. Second one is going to be anything that's toxic. What's toxic to the kidney? The first thing that's toxic to the kidney is drugs. So antibiotics such as aminoglycosides, antifungals such as amphotericin, anti-tumors such as cisplatin, or radiocontrast dyes or rhabdomyolysis, because that breaks down muscles, releases myoglobin, and that damages the tubules of the kidney. Now let's move further in this diagram. So further on, if we get any sort of obstruction or blockage, we can get post-renal failure, which essentially is a blockage which leads to buildup of pressure which damages the kidney. So what can be the cause over there? The first thing is the ureters, so urethral stones. Second is going to be any sort of bladder problem. So that can be, for instance, neurogenic bladder. Neurogenic bladder can be due to a stroke, which can then lead to an hypoactive bladder. So therefore your bladder isn't functioning as good as it should be. And we can also have prostate problems. So that can be either prostate cancer or that can be benign prostatic hyperplasia. Last but not least is urethral problems. So we can have urethral strictures, or we can have posterior urethral valve, which is commonly seen in boys. Now you know all of the causes for acute kidney injury, super high yield for the USMLE.